I'm Dr. Michael Fehlings. I'm a professor of neurosurgery at the University of Toronto and head of the spinal program at the Kreml Neuroscience Centre, Toronto Western Hospital. So the Scoli-RISK-1 study was a prospective multi-center international study to determine the rates of neurologic complication in high-risk spinal deformity and to examine the outcomes of the neurologic complications, and then to try to get a handle on some of the risk factors that could be predictive of these complications. There were 15 centers internationally, 9 in North America, 3 in Europe, and 3 in Asia, involving a total of 45 surgeons. We enrolled a total of 276 patients, and we undertook a variety of very rigorous clinical and radiographic examinations with a particular focus on looking at the neurologic outcomes using the standardized American Spinal Injury Association score. We used a web-based data collection system, and the data were externally monitored. The study was a collaboration between AO Spine and the Scoliosis Research Society. The principal investigator was Dr. Lawrence Lenke, and I'm the co-principal investigator. The main conclusions of the study were that in so-called high-risk deformity cases, which were defined as patients having a scoliotic deformity of greater than 80 degrees on the Cobb angle, or the patients requiring a revision spinal deformity operation, in particular those individuals requiring a 3-column spinal osteotomy, that there are neurologic complications. And at 6 weeks, the rate of motor complications was approximately 17.8%. There was some improvement that did occur, but at 6 months, there were still just over 10% of individuals who had a sustained neurologic complication. So these data very accurately define the neurologic risks in so-called high-risk deformity, and this can really be considered the gold standard data in this arena. Now, we're now doing some predictive modeling to try to get a handle on which risk factors are predictive of the complications. So far, we have determined that the age and the severity of the spinal deformity are predictive, and in particular, patients requiring fairly complex procedures where there might be multi-staged surgeries or 3-column osteotomy in the rigid spine do seem to predict higher rates of neurologic complication. Now, where is this going in the future? We're planning on undertaking Scoli-RISK-2, which will be to undertake a prospective randomized controlled trial of a neuroprotective drug, riluzole, which is a sodium channel blocker, and to see if pre-treating patients undergoing high-risk spinal deformity surgery reduces the risk of neurologic complications, and if one occurs, results in a better outcome. The take-home message for spine surgeons is to be aware of the high-risk patients with a spinal deformity. These patients need to be managed in expert hands, and very rigorous attention to blood pressure management and protocols to manage the neurologic complications is essential.